This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised.
I think it's hard to say exactly where seduction becomes coercion. And so I think because of that, our sort of stories about sex have a lot to tell us about sexual coercion and sexual assault and rape.
In this episode, I speak to Zoe Peterson, professor at the Kinsey Institute, to explore the complexities of human sexuality and its connection to sexual misconduct.
Men are at risk for victimization too, and in fact, probably many of the risk factors for perpetration are also vulnerability factors for victimization, and helping men to not only not be perpetrators, but also not be victims might be something that men might be able to get more on board for.
This is the #NoExcuse Podcast, discussing the challenges and complexities and potential solutions in preventing and responding to sexual exploitation, abuse, and harassment in the aid sector. Through interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and global focal point for the department. I'm excited for today's conversation with Professor Zoe Peterson, a researcher at the Kinsey Institute, which has been a global leader in the study of human sexuality for over 75 years. Welcome to the #NoExcuse Podcast, Zoe.
Thank you so much for having me. I'm glad to be here.
Your research focuses on human sexuality, gender, consent, and experiences of unwanted, coerced, and non-consensual sex, both from the perspective of victims and perpetrators. What is it about sex that can help us better understand sexual misconduct in the context of aid work?
Yes, so I think a lot of researchers who study sexual assault and rape really classify themselves as violence researchers or as trauma researchers, but I've always sort of thought of myself as a sex researcher, and I think one of the reasons for that is because I'm really interested in kind of those fuzzy gray areas between what we consider to be sex and what we consider to be sexual misconduct or sexual assault. And I think we like to believe, want to believe that there are these very stark and clear distinctions between sex and sexual assault or rape. I've even heard people sort of say we shouldn't refer to non-consensual sex because rape isn't sex. And I appreciate the idea behind that, but I think the problem with that is that sometimes rape doesn't look so different from what we think of as sex. And so that's one of the things that interests me. So, for example, I think especially if we think about sort of our script for what is typical heterosexual sex, a lot of people have this kind of script for how sex between a man and a woman goes. And often that script kind of says that men are the ones who, most want sex. And so men initiate sex and they're the ones trying to get sex. And women are stereotypically more reluctant about sex. And so women are kind of uncertain and maybe a little more resistant, and they initially seem kind of unsure. And it's men's job to warm them up and convince them and seduce them and tell them it's going to be okay and tell them they love them and make them feel safe and comfortable and convince them to have sex, seduce them, essentially. And I think, the distinction between that kind of seduction script and sexual coercion is a really fine line. And I think it's hard to say exactly where seduction becomes coercion. And so I think because of that, our sort of stories about sex have a lot to tell us about sexual coercion and sexual assault and rape. And I think because these lines aren't as distinct as maybe we would hope they are, sometimes it can be really confusing for victims that, victims think rape or sexual assault must be very violent, or perpetrators must be, these very bad, mentally ill, deranged individuals. And so because of that, they don't recognize that their own experiences qualify. And we know that about really over half of individuals who've experienced rape or sexual assault don't label their experiences as that. They don't recognize that their experiences count as that. And I think it can be even more confusing when there's power differentials involved, which may be potentially the case in aid work, for example. And I think it can be the case when it's not explicitly violent, or when the perpetrator doesn't fit their stereotype of a perpetrator, which again, I think might be relevant in aid work contexts, so maybe the perpetrator is someone they respected and liked, someone they've been working side by side with, someone who shares their values around aid work, and none of those things fit their stereotypes of who a perpetrator is. And so then it becomes harder to draw this distinction between, was this just sort of bad sex, or was this sexual assault or rape?
Maybe let's shift to the concept of consent, which is really central to understand sexual misconduct. And these are some of the elements you've been studying. Could you help us unpack the difference between wanting sex and consenting to sex?
So this is some of my earliest work was looking at this distinction. So especially in the past, and I think still somewhat today, people often conflate this idea of unwanted sex and non-consensual sex. So, for example, people will sometimes refer to rape or sexual assault as unwanted sexual experiences. But I have really argued in my work, and I think in my work and other work, people have shown that unwanted sex is not exactly the same as non-consensual sex. So sometimes people can want sex that they don't consent to, or not want sex that they do consent to, and that these are kind of different things, that are wanting something and agreeing to it are not the same. And I sometimes think it helps to take this out of the realm of sex in order to think about this. So I think if we think about this in our other realms of our life, it's easier to understand. So, I may not want to go to work first thing on Monday morning, but I might agree to go to work first thing on Monday morning anyway. Or, if I'm at a restaurant and they come around with the dessert cart, I may kind of want to order 4 desserts from the dessert cart, but I don't agree to order 4 desserts from the dessert cart. So wanting something and agreeing to do it are not always the same thing. So in the case of sex, there's quite a bit of research that suggests that sometimes people willingly and maybe even without coercion agree to have sex that they don't entirely want to have. And I think we see this especially maybe in relationships. So, people may not really be in the mood for sex, but they agree to because they want to make their partner happy. They want to strengthen the relationship. They know their partner's done it for them sometimes in the past. And that may not always be bad. Sometimes it may be a problem, but at least it's not quite what we mean by sexual assault or rape. It's a different issue altogether. But maybe more important for the issue of rape and sexual misconduct, sometimes people might say no to something that they do want in some ways. So sometimes people report that, they had feelings of wanting to have sex, even though they ultimately said no to it. So maybe they felt sort of attracted to the other person, they felt sexually aroused in the moment, but they ultimately refused sex. And I would argue that if they refused sex, but the sex happened anyway, that's rape, even if they had feelings of wanting to have sex prior to it happening. And I think it's really important to draw those distinctions, because if we treat rape as unwanted sex, then, if someone had feelings of arousal or attraction to the other person, even though they said no and were forced, then they may blame themselves. They may think their experience doesn't count. Other people may blame them for what happened, when in fact it's really the consent that matters, not their internal feelings of whether they wanted or didn't want sex in those situations.
You've researched the both perspective, be it the victims and the perpetrator. So you mentioned the perpetrator. From your research, what risks of or factors that could contribute to someone becoming a perpetrator of sexual misconduct, especially if we look at the aid sector?
Yes, so I haven't specifically researched the aid sector, of course, but I'll talk kind of generally, and then I'll talk about some risk factors that might, I think, be particularly relevant for the aid sector. So there's a lot of risk factors that the research has identified. I should probably start this by saying almost all of the research is focused on men as perpetrators, and men are the most common perpetrators. But I think that is an important caveat, is that almost all the research is on men. So has looked at risk factors like hostility towards women as a risk factor, lack of empathy, narcissism, psychopathy. Those kinds of things have been researched pretty heavily and do appear to be risk factors for perpetration. They're also all things that are very hard to change. And so I think it's important to know that those are risk factors. They also are a little difficult in terms of telling us how to intervene, because those are things that are hard to change. So, for example, some of the work shows that many men who sexually perpetrate are also sexual victims themselves. So they've experienced sexual abuse or assault in childhood or adolescence or adulthood. And in our work, we've found risk factors like anxiety, concern about sexual performance, distorted sexual self-concept, so a sense that, sex is their primary source of self-worth, dysfunctional sexual behaviors like using sex as a way to get attention. So those are things I think that speak a little more to vulnerability and might be places where we can intervene more and have more impact in kind of changing behavior. So maybe thinking about risk factors that are maybe especially relevant for the aid sector. So there's some research on kind of social groups and how social groups can contribute to risk for perpetration. So in social groups where there's large numbers of men, in social groups where men are the primary leaders, for example, and in social groups where the men allow each other to make sexual jokes about women, to sexually harass women, those are groups that are high risk for the men perpetrating sexual harassment and sexual assault. And so we see this in, men's sports teams, in the military sometimes. And so when there are these kind of social environments that allow for these kinds of attitudes to flourish or to develop, those can be places where there's high risk. And so to the extent that work environments become like that, if there's a lot of men who start making these sexist jokes and all, that can sort of become a high-risk environment in many cases.
How can we disengage, or how can we manage these type of environments? Because some might say, this is how it's done in our culture, or this is how it's done in this country. We're very touchy. They would say we're very warm people. What would you say to be able to manage that?
Yeah, it's difficult because there are cultural differences. And so I think, one way to manage it is to really talk about social environments as protective environments and, have a few individuals who are sort of maybe assigned to make this a protective environment and to model and demonstrate, sort of protective factors. So if you have even just a few leaders within a group who are the ones who say, oh, think those sexist jokes are funny. And, oh, I like that, I like that we're warm and touchy-feely, but, that makes some of the women in our group uncomfortable. So let's cut back on this particular type of warmth that, that we're engaging in. Just a few individuals who are kind of leaders who speak up, that can suddenly become a really protective environment rather than a risky environment. So I think the good news about these social groups is that they don't have to be risky. They actually can be very protective in some cases.
Your experience as both a researcher and a licensed psychologist brings quite a unique perspective to this conversation around the prevention of sexual misconduct. Based on your work, what approaches do you see the most promising when it comes to preventing sexual misconduct? And I think, and this is my personal perspective on this, also, I do think that bringing men to these conversations is also part of the prevention work. What are some of the things we can do to be able to prevent better?
Yes, I think this is a really tricky question. So in general, there have been kind of three sort of primary approaches to sexual assault prevention that have been studied. One is an approach that's aimed at what we see as potential victims. So usually that's women. We identify women as kind of the most likely potential victims. And that's kind of a risk reduction approach. And so we train women to protect themselves, basically, against being victimized. So, maybe to recognize when they might be in a risky situation and get out of it, some very specific kinds of self-defense approaches, those kinds of things. And there's at least one program in that's been shown to be really quite effective in that area. We also have bystander intervention. So this is training kind of third parties to say, oh, I see someone maybe targeting someone for, for sexual harassment or assault, and I'm going to stop and intervene and stop them from engaging in that behavior. And then there's interventions aimed at potential perpetrators, which is usually men. So interventions aimed at men, that's in theory supposed to stop them from perpetrating. And that's things, often like empathy building, teaching them about what is rape and sexual assault, what impact does it have on victims, those kinds of things. And that last group is the ones that probably has the least interventions and has been shown to be the least effective. So the research really has not found it to be very effective, especially in stopping actual sexually aggressive behavior. And yet, I'm like you. I think that's what we need. Like, if we really want to stop the problem, we need to prevent people from ever trying to sexually aggress in the first place, not help women protect themselves and not help bystanders intervene and stop it. We want people to never attempt sexual assault in the first place. And so I really think we need to think in new and novel ways about how to prevent perpetration in the first place. And I don't honestly have definite answers around that at the moment. I have a few thoughts, but they're kind of untested thoughts at this point. One thing I think is that it would probably be really useful to intervene much earlier when people are young. So one thing some of my colleagues at the Kinsey Institute and I are doing right now is going into elementary schools and teaching kids about healthy boundaries, healthy relationships, and consent when they're in elementary school. So talking about things like, how to tell people when you don't want to be tickled or hugged. So starting very early before they have romantic and sexual relationships. We're doing it and we're hoping for the best, but you would have to have a lot of money and resources to then follow those kids and compare them to kids who didn't get that. So it's hard to prove that it's effective. So I think one of the reasons our interventions don't work for men is telling men how not to be rapists probably makes men pretty defensive, and it, if anything, probably does as much harm as it does good. Whereas, I think if we sort of address the fact that actually men are at risk for victimization too, and in fact, probably many of the risk factors for perpetration are also vulnerability factors for victimization, and helping men to not only not be perpetrators, but also not be victims might be something that men might be able to get more on board for, and it might feel like their experiences are less dismissed in that way. So I think that might be something that's worth exploring more in the future.
Could you explain what victimization means?
Yes, there's this overlap between experiencing non-consensual sex and perpetrating non-consensual sex. So we see this both boys who've experienced child sexual abuse, so an adult who has perpetrated against a child are at risk for perpetration, but also individuals who've had sort of peers who have perpetrated non-consensual sex with them in adolescence or adulthood are more likely to perpetrate against peers in adolescence or adulthood.
When we talk about the question about what is it about sex that could help us better understand sexual misconduct, and we mentioned that men are usually the perpetrator, is there a link between sex drive and the act of committing sexual misconduct? And how usually they say men have a higher sex drive. Is that a correlation, or is this just a myth?
Yeah, it's a complicated question, right? So yes, the research does suggest that there is a correlation. This is a tricky area for me because I want to say this very carefully. There is a correlation between heightened sex drive, things like experiencing more sexual desire, having more sexual partners, those kinds of things, experiencing, greater sexual arousal in laboratory settings, for example. Those kinds of things are correlated with a risk of perpetration. But I think it's important to say correlation is not causation, and that doesn't mean, I don't think, that a higher sex drive causes men to perpetrate. My guess is that there is a very strong sort of interaction between sort of this kind of high sex drive and some other attitudes like, hostility towards women, entitlement about sex, kind of lack of impulse control. So I don't think it's sex drive alone that causes men to perpetrate. It's sex drive in the context of a lot of other factors that may contribute to risk for perpetration.
And is there any research that confirms that men have a higher sex drive?
There's a variety of studies that suggest that on average, and again, it's an average, so lots of women have higher sex drives than lots of men, but on average, based on a lot of different metrics like number of times they think about sex, number of times they want to have sex, those kinds of things. Based on a lot of different metrics, on average, men tend to report higher sex drive than women. And there's a lot of debate about whether is this biological or is this sociological, right? Like, is this because we have these sort of gender expectations and men are permitted socially to have a higher sex drive than women? And if we didn't have kind of cultural restraints on men's and women's sexuality in the way we do, would there still be this difference? And I think that's something we can't really resolve with research because we can't experimentally randomize men and women to not be part of this culture. So we don't know if it's biological or cultural, but on average, that does seem to be a finding that is pretty consistent.
Interesting. Thank you. Is there anything else you would want to add to provide a nuance?
I mean, I think it's important to say that, when we think about the causes of perpetration, it's likely incredibly complex, and there's probably many different kinds of perpetrators with different risk factors. So, different types of perpetrators with different types of risk factors and different motives for perpetrating. And in reality, I think we just need more research on perpetrators. I think for a long time, there was so much research on victims' experiences, which is incredibly important. I think we need to understand victims' experiences to understand how to help victims recover. But I think we're a little behind in understanding perpetrators and what their motives are and what the risk factors are. And I think that's part of why we don't have clear answers on how to intervene and prevent perpetration.
And to end on a personal note, why is this topic important to you?
Yes. So I think there's a lot of answers to that question. I'm a psychologist, and so I care a lot about mental health, and sexual assault and rape are threats to mental health. I'm a sexuality researcher, and I care about sexual health, and sexual assault and rape are threats to sexual health. But I think also I'm a woman. I think sexual assault and rape impact all women. Even if we are lucky enough to escape being victims of sexual assault and rape, I think all women, or virtually all women, probably all women, experience, some forms of sexual misconduct or exploitation, or whatever kind of umbrella term you use. The unwanted sexual attention, or the comments, or the, uncomfortable looks, or the, strokes of our arm or shoulders, or the, bodies pressed against us at the bars or the nightclubs, or, sort of those low-level behaviors that are part of that continuum of sexual misconduct and sexual exploitation that set the stage for rape and sexual assault. I think all women, face those. And also, I think that all women have to walk around in their lives fearing sexual assault and rape. So all women have to, think, is it safe for me to be alone in this situation? Is it safe for me to go into this place? Is it safe for me to be with these people I'm about to be with? And I think that takes a lot of emotional and mental energy throughout our lives. And there are times when we decide not to do things that we want or maybe even need to do because of fear of rape and sexual assault. And I think that's a way in which rape and sexual assault costs all women throughout their entire lives, even if they're not victims of it. And so for that reason, I think it's personal for all of us.
Mm. Yeah. And even in my questions, as I was reflecting, how can a victim be more prepared?
Yeah, I think we're all taught to think that way, right? Like, how can we protect ourselves?
Yeah.
And
And it's also, as you were saying, it's one of the programs that was the most successful, which is how do we empower women to be able to protect themselves? And that's one of the preventive measures that works, because we are the kind of the prime target. So
we're motivated.
Yes,
right?
Exactly.
We're motivated. Yeah.
Hence why that's why it's a bit harder for men to get them to the conversation, because the motivation is a bit harder to find. But I guess if they have a daughter or a wife or a sister or a mom, I think, it's enough to get that motivation. But thank you so much, Zoe, for sharing with us your knowledge and your expertise on the topic of sexual misconduct, and for making it your personal mission to uncover some of these sticky issues on the topic.
Thank you. It's been a pleasure.
Thank you for listening. If you have any feedback or questions, feel free to reach out to us to prseah@who.int. Until the next time, goodbye.